All right, so for our patient today, we're doing trach suctioning and the dressing change for the trach tube. And so I'm gonna come into the room, wash my hands, introduce myself, check the patient's name and date of birth, and check their wristband. And then I'm gonna make sure to do our safety checks, which is making sure that the suction is on 80 to 120, and making sure the oxygen is on, and then making sure we have our emergency trach kit and continuous pulse ox monitoring and the mechanical or ventilation or bag mask. Yeah. And so I will put on my mask with my eye shield and raise the bed and put them in Sunny Fowler's position. I'm gonna wash my hands and put on gloves. And I'm gonna give them a little drape. I'm gonna take off the, nope, that is for the next skill. I'm gonna give them a drape. And I'm gonna get my kit and open this up. And then I am going to open this up and fill it with saline, and then hyperventilate them with oxygen. And then I'm going to take my gloves off and I'm going to wash my hands, and then I'm going to open this up. I'm going to put on my sterile gloves. Then I'm going to get out the tubing. I'm going to take it, I'm going to wrap the tubing around my hand. And then I'm going to grab the tube connected to the suction with my non-dominant hand. So now this isn't sterile. I'm going to put it onto the suction tubing, and I'm going to swap hands, and then I'm going to make sure that the tube works, which it does, and then I'm going to slowly insert it into the tube and wait until the patient coughs, and then I'm going to start suctioning and twisting and then pulling the tube out. And then I'm going to dispose of the tube in my gloves. Then I'm going to wash my hands. And then I'm going to put the oxygen back on the patient. And now we are going to do the dressing change. So I'm going to grab my kit and I'm going to wash my hands. I'm going to put on clean gloves. going to take off the dirty drape and then remove the oxygen. And then open my kit, get my gloves out. My gloves on. Apparently I have issues with this. Alright. And then set up my sterile field. And then I'll put saline in 2 of these bins. And then what I'm going to do is I'm going to take the cannula and I'm going to put it in the first bin. And then I'm going to take the brush and clean the inside and the outside. And I'm going to put it in the second bin. I'm going to take this and clean around the top and the outside, and I'm going to leave it to dry. And then I'm going to take another one of these and put it in the cleaner water, and then I'm going to clean the patient stomach, and then I'm going to go from the inside out. And I'm going to have 1 Q-tip for each quadrant. And then I'm going to dry underneath. And then I'm going to dry the cannula with the Q-tip, or the pipe cleaner. And then I'm going to put that back in place. And then I'm going to put the new drape on. And then I'm going to take the second tie and I'm going to put it on before taking off the first tie. And then I'm going to gather my supplies, take my gloves off, and I would have put the oxygen back on the patient and wash my hands and put the bed in a low and locked position and document.